Have you ever been woken up in the middle of the night by a burning pain in your big toe? Not a dull ache, not a little stiffness, but a sharp, searing fire, like someone dropped hot coals right into your foot. Even the weight of a bedsheet feels unbearable. That's gout. And if you felt it once, you'll never forget it. They call it the disease of kings. But these days it strikes everyday folks, especially those of us past 60. It doesn't care how healthy you think you are. It sneaks in, quiet, sudden, violent. So what is gout really? Why does it choose our joints, our nights, our peace? Is it something we ate or something we inherited? In this video, we're going deep. We'll look at why gout happens, who gets it, and most importantly, how you can live without fearing the next flare. We'll break down the science in plain talk, and we'll share real-world steps, because life is too short to live afraid of your next step. Instead of waking up to pain, what if you woke up knowing your body was finally under control? Let's talk about how we get there, together. Gout is a kind of arthritis, but not the slow, aching kind most people think of. This is sudden, sharp, deep. At its core, gout is inflammation caused by tiny crystals that form inside your joints. These crystals are made from something your body produces naturally, uric acid. When uric acid builds up in your blood, it can harden into needle-shaped crystals. And where do those crystals like to settle? Right inside your joints, especially your big toe. Why the big toe? It's the farthest point from your heart. It stays cooler than the rest of your body, making it the perfect place for uric acid to turn solid. And when it does, your immune system sounds the alarm. It sees the crystals as invaders. So white blood cells rush in, trying to destroy them. But instead of fixing the problem, they spark a wildfire of inflammation. That's why the pain comes fast and furious. One joint is usually hit at a time. That's why doctors call gout a monoarticular condition. But it's not always just one. Some people feel it in multiple joints, knees, ankles, elbows, and it doesn't take years to build up. It can show up overnight, like a thief breaking in while you sleep. So while some joint problems creep in slowly with age, gout kicks the door down. Instead of a gradual warning, it screams. And understanding why that happens is the first step to stopping it. Uric acid isn't some foreign invader. Your body makes it every single day. It's the final product when your body breaks down something called purines, natural substances found in your cells and in many of the foods you eat. Things like red meat, seafood, organ meats, and even certain vegetables all contain purines. Your body processes them, turns them into uric acid, and ideally flushes it all out through your kidneys. But here's the problem. Sometimes there's too much uric acid being made, and other times your body just doesn't get rid of it fast enough. For many older adults, it's the kidneys slowing down. Age, medications, or other health conditions can reduce how well your kidneys function. So instead of uric acid leaving your body through urine, it lingers. It builds up in your blood. And when the levels get too high, that's when crystals begin to form. These crystals don't just sit quietly. They trigger your immune system. White blood cells rush in, trying to clean up. But instead of helping, they create more inflammation. Inside your joints, it's like a microscopic war zone. The result? Pain, swelling, redness, heat. But it's not just about what you eat or how your kidneys work. Sometimes your body produces extra uric acid simply because of genetics or high cell turnover, like in certain cancers. Still, for most people over 60, it's often a mix of what goes in and what doesn't come out. Instead of just guessing, knowing this two-sided problem, too much in, not enough out, gives you a powerful way to fight back. And the next question is, who's most at risk? If you're over 60, male, and have a few health issues, gout may already be lurking. Let's be clear, gout doesn't just happen by chance. It's often the result of several risk factors coming together over time. Age plays a big role. After 60, your kidneys may not filter as well as they used to, and with age, there's a greater chance of having other conditions like diabetes, high blood pressure, or chronic kidney disease that interfere with how your body handles uric acid. Gender matters too. Men are 2 to 6 times more likely than women to develop gout. For women, risk rises after menopause when protective hormones decline. Weight is another major factor. Excess weight increases uric acid production and decreases excretion. Even a 3.5 kg, about 7.7 pounds, weight loss can reduce your chances of a gout flare, according to long-term studies. Diet? Absolutely. Red meats, organ meats, shellfish, even sugary sodas and fruit juices, especially those with high fructose corn syrup, can spike your uric acid. One viewer put it perfectly: gout hit me 4 hours after eating sausages. Sometimes it's not even the food, but an ingredient inside. Medications can surprise you. Low-dose aspirin, certain diuretics, NSAIDs, they all impact how your kidneys handle uric acid. And here's one many forget: family history. If your parents or siblings had gout, your chances are higher too. So while you can't change your age or genes, you can control many of the other pieces. That means more power in your hands than you might think. Because the better you know your risk, the sooner you can stop that first or next attack. Now let's look at how that attack actually feels. A gout attack doesn't tap you on the shoulder. It slams the door open, fast, loud, and painful. One moment, you're asleep. The next, you're wide awake, gripping your foot, wondering what just hit you. The first sign is usually sudden, severe joint pain. Most often, it starts in the big toe, specifically the joint at its base. Doctors call it the first metatarsophalangeal joint, but you'll just call it that place where it hurts like hell. This joint becomes red, swollen, warm, and incredibly tender. Even the brush of a bed sheet feels unbearable. For many, the pain reaches its peak within 24 hours. It's not a dull ache. It's a throbbing, stabbing, fire-like sensation. And while the big toe is the most common, gout can also strike ankles, knees, wrists, elbows, fingers. In some cases, people develop tophi, small, firm lumps under the skin filled with uric acid crystals. They show up on fingers, ears, or around joints. These are signs that gout has been around longer than you realize. But how do doctors know for sure? The gold standard is a joint aspiration. That means using a needle to remove a small amount of joint fluid. Under a special microscope, doctors look for needle-shaped crystals that are negatively birefringent, a fancy way of saying they bend light in a certain way. If those crystals are there, it's gout. Blood tests can check your serum uric acid levels. But here's the catch. During a flare, those levels might be normal or even low. So they help, but they don't tell the whole story. Imaging, like X-rays, can reveal long-term joint damage. You might hear phrases like rat bite erosions or punched out lesions. Those are classic signs of chronic gout, but they take time to develop. The sooner you catch it, the better your chance of stopping the damage. And if a flare hits, what can you actually do? When a gout flare hits, every second counts. The sooner you act, the faster you can stop the pain from spiraling out of control. Step 1, rest the joint. Stop walking on it. Elevate your foot if you can. Ice packs can help reduce swelling and numb the area. Step 2, manage the inflammation. This is where medications come in, and they work best if started within the first 24 hours. The top 3 options are NSAIDs, like naproxen or indomethacin. These reduce inflammation quickly, but aren't ideal if you have kidney issues, ulcers, or high blood pressure. Colchicine works by calming the immune system's overreaction to the crystals. It's effective, especially in early flares, but can cause stomach upset in some people. Corticosteroids, pills like prednisone, or even injections, are powerful when NSAIDs and colchicine aren't suitable. They reduce inflammation fast, especially in older adults who may have other medical conditions. But what if you want something more natural? Some people find relief with tart cherry extract, either as juice or capsules. It's believed to lower inflammation and support uric acid balance. One study showed it helped reduce CRP levels, an inflammatory marker, and improve kidney function when used alongside traditional therapy. Others turn to herbal creams, like those from traditional Chinese or Tibetan medicine. One review of nearly 2,000 patients showed topical herbal treatments help reduce swelling and pain without major side effects. Now let's clear up a common myth. Should I stop all my medications during a flare? No. If you're already on a long-term uric acid-lowering medication, don't stop it during a flare. Stopping and starting causes more harm than good, but don't start new medications during the middle of a flare either, unless your doctor specifically tells you to. Let the inflammation calm down first. So the goal in a flare: calm the fire, ease the pain, then make a plan so it doesn't happen again. Because the next step is key: prevention. Stopping the pain once is good. Stopping it from ever coming back, that's where the real victory lies. Many people think, I'll just wait for the next flare, then take something when it hits. But that's like mopping up a flooded kitchen without fixing the broken pipe. The truth is, long-term control of gout's possible, but it takes a clear goal and a plan. That goal? Keep your serum uric acid level below 6 milligrams per deciliter. Below 5 if you have severe symptoms or tophi. Why does that number matter? Because below 6, those sharp crystals stop forming, and over time, the ones already in your joints begin to dissolve. No crystals during no flare. To get there, doctors may prescribe urate-lowering therapy, ULT. There are two main types: xanthine oxidase inhibitors, XOIs, like allopurinol or febuxostat. These reduce the amount of uric acid your body makes. Allopurinol is often the first choice, even for people with kidney disease, according to the American College of Rheumatology's 2020 guidelines. Urics, these help your body get rid of uric acid through the urine. They're used less often, but may help in certain cases. But here's what most people don't realize. You don't always start these medications right away. Doctors usually wait until you've had 2 or more flares per year, or if you have visible tophi, kidney stones, or joint damage. And once you start, you need to stay consistent. A major trial, the Stop Gout study, showed that more than 60% of patients who stayed on ULT for 2 years had far fewer flares. But those who stopped or skipped doses, the pain came back. Still, medication isn't the whole answer. Lifestyle changes make a big difference too, especially as we get older. Studies show that losing even a modest amount of weight, more than 3.5 kilograms, reduces flare risk. So does drinking more water, eating more vegetables, and avoiding sugary drinks. One viewer said, "I haven't touched red meat or soda in years, and I've been pain-free." Another kept a food diary and discovered their trigger wasn't food, but breadcrumbs inside sausages. So instead of just reacting to flares, imagine preventing them. Instead of relying only on pills, imagine taking charge of your choices. It's not always easy, but it is possible. And every step forward reduces your risk of being jolted out of sleep by that familiar, fiery pain. So what can you start doing today? That's what we'll explore next. Living with gout doesn't mean living in fear. You don't need to wait for the next flare to take control. In fact, the best time to act is between attacks, when your joints are calm and your mind is clear. So what can you do starting today? 1. Keep a food diary. It sounds simple, but it works. One viewer shared how they discovered their trigger wasn't just red meat, but wholemeal bread and breadcrumbs hidden in sausage patties. Write down what you eat and when pain shows up. Over time, patterns appear, and you can start removing silent culprits. 2. Hydrate. Seriously. Water helps your kidneys flush out uric acid. Aim for at least 8 cups a day. More if you're active or sweating. Avoid soda and sugary drinks, especially those with high fructose corn syrup, a known trigger. 3. Move your body. Gentle, regular movement helps circulation, reduces weight, and supports joint health. You don't need to run marathons. Walking, stretching, light swimming, they all count. Every pound you lose lightens the load on your joints and helps lower uric acid. 4. Choose your foods wisely. Favor fruits, vegetables, whole grains, nuts, and lean proteins. Go easy on red meats, shellfish, and organ meats. And remember, alcohol, especially beer, is a major flare trigger. 5. Talk to your doctor about supplements. Tart cherry extract, vitamin C, omega-3s. Some natural options may offer support, but always check before adding anything to your routine. 6. Build a team, not just a pill bottle. Gout is more than numbers on a chart. It's your sleep, your mobility, your peace of mind. Find a healthcare provider who listens. Consider connecting with other patients, online or in person. 7. Track your uric acid levels. Many pharmacies now offer affordable testing. Knowing your numbers like watching your cholesterol. It keeps you aware, empowered, in control. And maybe most important of all, stay hopeful. Yes, gout is painful, but it's also one of the most treatable forms of arthritis. With knowledge, consistency, and a little patience, you can break the cycle. Instead of fearing your next flare, imagine looking forward to pain-free days, steady sleep, and the freedom to move as you please. That kind of life isn't out of reach. It starts with small, steady steps, taken today. If this video helped you understand gout a little better, if it gave you hope or a new idea to try, don't keep it to yourself. Someone you know may be quietly suffering. Someone else might be waking up tonight, clutching their foot, wondering what's wrong. Share this with them. Leave a comment if something in your journey has helped. And if you want more videos like this on real health topics with clear, honest guidance, hit that subscribe button. It helps the channel grow. But more than that, it helps real people take back control of their health. You're not alone in this. Gout might knock you down, but knowledge, action, and support will get you back up. Take care of yourself, and I'll see you in the next video.